We talk about improving health outcomes by working with other agencies or approaching the achievement of health outcomes in different ways. So working with police, education, housing, all sorts of other groups who might help us achieve a far higher level of health outcome. What do you see as the value in doing that? Realistically, if you had one or two key things you think could be achieved for health, what would they be?
Well, here's an example from the United States where we began to work with a group of healthcare providers in Memphis, Tennessee. The population there, it has a high degree of difference in socioeconomic status, and the African American population there has a very big burden of chronic diseases, hypertension, diabetes, and obesity. The healthcare providers were looking at how can we make this population healthier, and they were thinking about adding on more visits. Could we get these patients to come in for another 15-minute visit, maybe 4 times a year instead of twice a year? Nothing much was happening. When we reached out to the Church Health Network and began to convene social workers and the schools and the churches in these meetings about health, the conversation totally changed. There was one minister who said, "You see these patients twice a year for 15 minutes. I see them twice a week for 2 hours." So he said, I'll take diabetes and you guys can go work on something else. And he began in the meal times to serve them smaller plates, healthy food. And in his sermons, he was talking about the sanctity of health. He said, being a member of this church means you take care of yourself so that you can be a good church member and you can be a good family member. And I think without reaching outside the boundaries of healthcare, we're going to be very limited in our accomplishments in health.
Yeah, and it allows us to touch people in different ways, doesn't it? At a spiritual level, an emotional level, physical level, and that whole achievement of life for people.
I was in Scotland recently, and I was asking the same question. How do we look beyond the healthcare system? And I went to a school that's in a pretty deprived neighborhood. I had a group of healthcare CEOs with me, and I said, who will the faculty be to teach us about this question? And the faculty were kids, 16-year-olds and 14-year-olds. And the CEOs were asking them, well, how do you define health? And the 16-year-old stood up and said, well, first of all, we're at school and we've got to achieve our academic goals. That's a part of our well-being. And they each one said, I'm better at math, I'm better at science, but I've got my improvement projects to help me achieve my academic goals. Right. But they said it's bigger than that, and you've got to be physically healthy. So each child engages in a sport, and they also have aims in that sport, and they're achieving goals. And then thirdly, they said you've got to be intellectually aware. So they all join an art, and some of them are taking photography, and some writing poetry, and some acting in plays, and again achieving their goals. But what you see is this tremendous sense of looking outside health to find exactly what we aspire to.
Yeah, wow, wonderful.